to actually deal with it as close to 2 years or 2.5 years as possible. The problem is also a lot of them have got heart issues. Are you prepared to handle the post-operative care? Are you prepared to put the child under general anesthesia, which has got, potentially of life-threatening issues are also there. So it's a very difficult decision to take. If you only look at it from the eye perspective and isolate yourself, it's fine.
Yeah.
But at the end of the day, after the surgery, you can't tell the parent, oh, by the way, you can't let the child touch his or her eyes for the next 2 weeks. How do you do that? I mean, you have to be prepared that the child may need to be sedated, all that. So, when you openly talk about it, then people are a little bit more informed about what the surgery is the easy part of it.
Exactly. And one more thing,
It's,
the drops, which are the drops that are safe for
yeah,
dilating the eyes? These are the
yeah,
questions I've been getting a lot of questions about.
sure. That is a standard thing. Atropine to be avoided.
Yeah, yeah.
Very tough.
Can we admit people now, ma'am?
Yeah, please.
I think we should now.
Yeah.
It's already past few minutes. So, by the way, we'll be having some international audience also, Dr. Rekhi. Just for your knowledge, we are trying to tell you.
Sure.
That is why we prefer English.
Yeah.
I can see you're also wetting your whistle.
Yeah, I have to do it more than you, son. We are in the same state, okay?
Yeah, someone recently told me apparently on Zoom calls, if you have a teacup and if you blow on it, people assume you're having tea. So you can basically have anything inside your cup.
You can have anything. I have other things. Don't worry about it. We'll have one of those.
Brinda, we are live?
Yeah. No, I don't. She's not live.
Yes, we are live.
Yeah, we are live.
We've been live for some time.
Yeah, 5.
वृंदा जी जब शुरू करना होगा आप बता दीजिएगा.
Maybe we could wait for another couple of minutes. And then...
Yes.
Yeah.
So amongst the persons with Down syndrome, what is the rarest thing you normally would see with vision?
I don't think there is anything that is pertinent to Down syndrome that would be rare. You could have a DS child with a rare condition. But it's not that is only seen in children or predominantly seen in children with DS. So it's like squints are seen, but the frequency of squints is greater. Powers are there, frequency of powers are greater. So, but there's no such thing that there is a rare condition,
Now,
which is, let's say,
how often would you see nystagmus?
How often would I see
nystagmus?
Quite common. It's not that uncommon. Yeah, I see it in regular population also.
Yes.
So it's not that it is. See, the only thing is when it comes to any child, whether it's with CP or DS or whatever, there are 66% of the population has got some eye issue.
Okay.
Whereas in the regular population, it may be 20 or 30%. So there is a greater frequency of problems, but it's not like there is a rare condition which is seen. Like, let's say there is a particular type of condition which is seen in 1 in a million people. It's not like in DS, I'll see it in 1 in 100.
Okay. And do you think this has increased over a period of time because of
Keratoconus has increased. In my experience, in the last 5 years, it has increased.
Okay.
So actually, there is a hospital in Hyderabad now, which is beginning to screen children with DS for keratoconus. And they're saying 50-60% of the people have got it. Now, the problem is that there are different definitions of keratoconus, and these definitions have altered. And in medicine, the strange thing is the moment you have a remedy which can make money, the goalpost starts becoming bigger. So more people fit into it so that somebody can make more money. So that's also, you have to keep it under. 35 years ago, if you had 200 sugar 2 hours after a meal, nobody prescribed medication.
Absolutely.
That 200 became 180, 180 became 160, 160 became 160 1.5 hours after a meal. Now it's 140.
Right.
So the number of people being treated for sugar elevation today is 100 times more than what it was 35 years ago. So who's
So,
benefiting?
you're saying that keratoconus is common?
Yes. So it is not common across a normal population. It was seen, there were studies which showed somewhere between 0 and 30%. I mean, different studies showed between 0 and 30% in children with DS. And when I started working with the Special Olympics, their data was showing it's about 3 to 4% of the population
Okay.
in DS. And I had seen 14 cases in 15 years or 16 years.
So what happens if we ignore that?
No, so what has happened is post-COVID, not only in DS, but in the regular population, I am for some strange reason seeing more number of keratoconus patients. So I don't know whether the vaccine has played a role or, I mean, it's anything is possible.
Yeah.
Am
Okay.
I suddenly getting more cases? I don't know. But
Okay.
like I think we till COVID hit, we had maybe 14 cases or something like that of keratoconus. From
I
COVID,
need to,
2 years after
talk to you
COVID to
on this.
now.
I need to talk to you on this because we can do one paper on this. Okay.
Yeah, sure.
We need
And
to.
shall we start
Yeah.
then?
Yeah,
Yeah,
please.
yeah.
Parul.
जी बिल्कुल नमस्ते, मैं पारुल। डाउन सिंड्रोम फेडरेशन ऑफ इंडिया के शनिवार के सेशन में आपका स्वागत है। आज 1 फरवरी है और हम बहुत खुश हैं कि आज हम उस टॉपिक पर बात करने वाले हैं जो प्रकृति की तरफ से मानवता को सबसे बड़ा तोहफा है, आँखें। कहते हैं कि आँखों से बड़ी कोई तराजू नहीं होती, तुलता है बशर जिसमें, वो मीज़ान है आँखें। आँखें ही मिलाती हैं ज़माने में दिलों को, अनजान हैं हम तुम अगर अनजान हैं आँखें। सच में दोस्तों, अगर आँखें ना हो तो हम इस खूबसूरत दुनिया को देखेंगे कैसे, महसूस करेंगे कैसे? तो आज हम इसी पर बात करने वाले हैं। बात करने वाले हैं डाउन सिंड्रोम से ब्लेस्ड बच्चों और एडल्ट्स में क्या समस्याएं होती हैं, क्या वो न्यूरोटिपिकल पर्सन्स के बराबर की ही समस्याएं होती हैं या कुछ अलग समस्याएं होती हैं जो आँखों की उन्हें आती हैं और उनका क्या कारण होता है और उन्हें हम कैसे एड्रेस कर सकते हैं। आँखों का तिरछापन या विजन का कम होना, इसे हम कैसे रोक सकते हैं या सही कर सकते हैं। इन सब पर बात करने के लिए हमारे साथ डाउन सिंड्रोम फेडरेशन ऑफ इंडिया के साथ बहुत दिनों से जुड़े हुए हमारे बहुत ही हम्बल और बहुत ही जो है हमें बहुत अच्छे से हमारे पेरेंट्स को करने वाले इस सब पे डॉक्टर प्रीति रेखी हमारे साथ हैं। हम उनका स्वागत करते हैं और मैं अपनी दोस्त समीक्षा को बुलाना चाहती हूँ कि वो आए और विधिवत रूप से डॉक्टर रेखी का परिचय हम सबके लिए बताएं। समीक्षा।
Yeah, thank you. Thank you so much, Paru. Yes, vision is the greatest blessing of nature to humankind. So good evening, everyone, and welcome in today's session. And persons with Down syndrome are more likely to have certain ophthalmic concerns, and the prompt detection through careful screening can significantly support their functional capacity and improve quality of life. So as parents, we are here to understand from one of the esteemed members of DSFI's medical panel, who will talk about all those eye-related problems which our champs are more likely to encounter, how to get their proper assessment of visual functioning done, and will also suggest when should we take action for seeking the expert's guidance or take call for corrections. And our today's guest will not be a new face for those who are regular participants of IIDSCs, but those who are going to hear him for the first time. I want to share that he is one of the experts who will not only correct your child's eyes capacity to see, but will also correct how as a parent you view those aspects. So as he has the ability to emotionally understand that what we as parents feel, see or experience things from our position when we see our child struggling with some vision issues. Our guest for today is Dr. P.S. Rekhi, from Spectrum Eye Care, Chennai. Dr. Rekhi obtained his postgraduate studies from prestigious universities in the US and Canada, and with a focus on different like dyslexia and learning disabilities. And his clinical training was from Sukarna Netralaya in Chennai. In 1991, his clinic opened and has been giving pro bono services to individuals with neurodiverse needs. He has been associated with us for almost 3 decades now. It is an immense honor to have you here on this platform, sir. Knowing you, that you can easily cover it for both our Hindi speaking and non-Hindi speaking audiences makes Parul extra happy. So we extend a very warm and hearty welcome to you. We all are waiting to hear from you so that we can be more vigilant while nurturing our young ones with extra chromosomes. Over to you, sir.
Thank you. Thank you so much. Brinda, can someone share the presentation?
Sir, we will.
Yes, but I'll do that. I will just do it.
Thanks. Good evening, everybody. I'm very happy. I've been associated with Surekha ji since 1997, and it's one of the pleasures of my life that I've been associated with all of you. It's helped me. It genuinely makes me feel extremely humble every time I meet up with your gatherings, because the kind of work that is being done here is unbelievable. There are very, very few organizations that I know that can do this kind of work. So without much ado, let's start off on this one. A small sort of an introduction. Can I have the second slide, please? Yeah. So the thing is that why is vision so important? Because roughly about 83% of whatever we learn comes from our eyes. So it's a very predominant sense. They say seeing is believing. And it is true, because until you see, you can't really learn things. Second slide, please. And I'm sure this 83 has probably gone up a little more since this thing. So comfortable vision versus sharp vision. So this is a very strong distinction I want to make here. Whenever you go to an eye doctor or an optician or whatever it is, the job that they do is help you to see sharp. And as most people who have worn glasses in the past will know, that a pair of sharp glasses need not necessarily be comfortable. And unfortunately, when we have children who are not able to communicate too well, the person who examines the eye, let's say the child has a power of -2, they always write a constant wear. Now, if you are prescribed a pair of glasses for constant wear, let's say of -2, and your older glasses, let's say, was -1, and when you wear the -2 and you feel that you're not very comfortable, your natural reaction is to remove the glasses, put on the older pair of glasses, and continue to work. Who takes off the glasses, because the doctor has written constant wear, the teacher or the parent sometimes ties this glass onto the child's head. So now you have an interesting situation. You have a child who is not comfortable, is trying to communicate with the parent or the teacher to say that I am not happy with these glasses, which is why I'm taking them off. And in defiance to this, the teacher or the parent is tying it to his head. So he's not only uncomfortable with his vision, he's uncomfortable with the way it is sitting on his face. And now he's irritated that you're not understanding what he's trying to say. And how do we expect this child to read or do whatever task we ask him to do or learn? It's not going to happen. Next slide, please. So the difference is it's not necessary to have comfortable vision with sharp vision. Next. I'm just going to be giving you a few statistics out here. So these are some of the common things that happen in children with DS. And different studies have shown different statistics. So the first one that you'll see is strabismus. Strabismus means squint. So some studies have shown 10% of the population has it, some show 57% of. So there's a range of them. Second condition is something known as amblyopia, which is also known as lazy eye. Now, this is about 3 to 36% of the population. Lazy eye का मतलब ये होता है कि suppose you have a child who's got, let's say, 0 power in one eye and +3 in the other. So wherever the brain sees, whether you see something 100 feet away or 6 inches from your face, the left eye sees better than the right eye at all distances. So at a certain age, what happens is the brain starts using one eye much more than the other. And let's say the child comes to you and or to me, for example, and we find that the power is +3 and we put a +3, the vision will not improve because the brain has decided that that eye cannot see. And all of these issues have to be sorted out before the child is 2.5 or 3. That's when we start working on this. The third thing on the list is something known as accommodation defects. Accommodation refers to the ability to change focus. So you're seeing something far, you're seeing something near. आगे पीछे देखने के लिए जो the focusing mechanism that is there, that doesn't work well. And this is very commonly seen in children who have got DS. Minus power, plus power, cylindrical powers is almost seen in almost every other child with DS. 80% of them have some kind of a power. Whether they need to wear glasses or no is a separate issue, but power is there. The other thing that is seen almost in every single child with DS is eyelid abnormalities. So you can have dandruff in your hair, which comes into the eyelashes and causes an infection or an inflammation. That is very commonly seen. The other thing that is seen a lot common is your nasolacrimal duct occlusion. Now, what this means is water from the eye has to flow into the nose, which is why when you cry, a certain amount of the fluid comes into your nose. Now, there is a passageway that's called the nasolacrimal duct. This gets blocked, which is why a lot of our children tend to have watery eyes. The solution to this is very simple. All you have to do is massage this area. Like, I don't know whether this is there. I think it's a pan India thing. If your grandmother sees you with a child, they'll say, massage this area. The child's nose will become very beautiful. It has nothing to do with the nose, but it has to do with clearing this obstruction. And if this obstruction is cleared, there is no chance of infection taking place in a newborn baby. Can I have the next one, please? The
Sir,
other thing that is seen, is
sir,
this
I
clear
will
for
speak in
everybody?
Tamil, sir.
Yeah, I'll come and speak a little bit in Tamil a little later because I think predominantly people are right now. Who wanted me to speak in Tamil? I'm not able to.
In Tamil, sir, I'm not English, sir.
Okay.
It is
Uh,
the participant named Sana. I mean, that's
Sana.
reflecting on the
சனாமா
screen.
அது சார் அப்புறமா தமிழ்ல நம்மளுக்கு அப்புறமா சொல்லுவார் இங்க predominantly ஹிந்தி இங்கிலீஷ் பாப்புலேஷன்னால
Oh,
அதுல
okay,
பேசுறேன்.
okay.
தேங்க்யூ.
I'll come back. If you can just, okay. So the other condition that comes into very common occurrence is something known as nystagmus. Nystagmus is when the eyes move left to right in a rhythmic pattern. This is seen roughly in 33% of the population. Keratoconus is something which is we are seeing more and more and more of late. One reason could be that a lot of the children that we are seeing have become older, and we see this more in older population in DS. In this, the cornea, that's the front part of the eye, becomes conical in structure and may need some therapy and some treatment for it. There are minor surgical procedures which are done for this. Cataracts are seen between 1 and 50% of the population. Retinal problems are seen 1 in 40%. Optic nerve problems are seen in 14%. Glaucoma, in which the pressure of the eye goes up, is seen about 6% of the population, which is pretty much normal compared to an adult population also. The other thing is, how do we, for me, the most important thing is, how does the child's vision develop? Next slide, please. So the milestones for development of vision is like when you're born, the brain doesn't know how to use the eyes. The eyes are still developing. It's like a computer which has not yet been programmed. So the first thing that develops in vision, which will happen by the 4th week in most cases, is when you ask the child to look at something, the child's eyes will look directly at it. So you say, look at my face, and you will see the child's eyes looking directly at you. It will not be looking away from you. Okay. This in children with special needs, sometimes I am prepared to wait till 4 months. But if it is not developed by the 3rd or the 4th month, you need to show it to somebody. And if you have friends who've got children, irrespective of whether they are special children or non-special children, this is the rule for everybody. By the 4th month, if the child is not looking directly at you, you need to rectify it then. The second thing is that once the right eye knows how to see and the left eye knows how to see, we have two eyes. So both the eyes must look at the same point. In other words, there should be no squint. So if by the 6th month, one eye is constantly looking away and the other eye is looking at you, you need to get it looked at immediately. Now, both these definitions, if there is a child, for example, who has a 45-degree squint or a 90-degree squint from birth, don't wait till 6 months. That's not going to rectify. What will rectify is if it's a 10 or a 15-degree squint, those can straighten out. Okay. The third thing that we look at, which is to my mind a lot more important, is this amblyopia thing that I was talking about, where we need to see by the age of 2.5. So before 2.5, I definitely want a thorough examination of the eye done. Where and for amblyopia is what we're looking at is the brain using one eye more than it's using the other eye. And to do this, you can even do this test at home, even on a 3-4 month old baby. So as an example, if my right eye, for example, is seeing 80%, my left eye is seeing 50%. Both eyes open, I'm seeing 80, correct? So if I close my left eye, I put a hand in front of this eye, I'm still seeing 80%. But if I put this, my vision drops to 50. So the baby will do this. You can do this on a 3-month-old baby, the baby will respond. So if you find that the child doesn't mind this eye being closed, most of the time. But every time you close this eye, the child gets agitated or moves the head away when they are looking at something else. Then the eye which you cover and the child does not get bothered, that eye has a problem. This is a very, very simple test and it can be done by teachers, it can be done by parents, it can be done by anybody. And it's a very useful piece of information that is given.
Sir, this slide in a little bit Hindi also, this slide.
Yeah, so I will repeat this whole thing. सो जब बच्चा पैदा होता है तो उनकी आंखों में कुछ मतलब एक कंप्यूटर की तरह होता है जिसमें प्रोग्रामिंग दी हुई है. सो सबसे पहले चीज जो डेवलप होती है वो है कि बच्चे को सीधा देखना है. तो जैसे मानो आप बच्चे को बोलो मुझे देखो, वो आंखें इधर उधर नहीं होनी चाहिए, सीधे आपकी आंख की तरफ देखनी चाहिए. 0 डिग्री एरर होना चाहिए. इसको हम फिक्सेशन बोलते हैं. तो दोनों आंखें हैं, एक आंख में फिक्सेशन होनी चाहिए, दूसरी आंख में भी होनी चाहिए. ये नॉर्मली 1 महीने के अंदर डेवलप हो जाता है या 1-1.5 महीने के अंदर डेवलप हो जाता है. स्पेशल बच्चों में 4 महीने तक मैं इंतजार करने के लिए तैयार हूं. पर अगर बच्चा आपको देख रहा है और हर वक्त जब आप उसको बोलो मुझे देखो और उसकी आंख बोलो वहां पर देख रही है और बोल रहा है मैं आपको देख रहा हूं, वो इमीडिएटली आप किसी को जाके दिखा दीजिए. ये 4 महीने के अंदर डेवलप हो जाना चाहिए. दूसरा है हमारे पास 2 आंखें, एक आंख से अगर आपको वो देख रहा है, दूसरी आंख से भी उसको आपको देखना चाहिए. तो अगर एक बार ये फर्स्ट स्टेप डेवलप हो जाता है, दोनों आंखों को साथ में आपकी तरफ देखना चाहिए. इंटरसेक्शन होना चाहिए आपके चेहरे पे या जो भी आप चीज उसको दिखा रहे हो. उसका मतलब अगर एक आंख कहीं और देख रही है, एक आंख आपको देख रही है, उसका मतलब स्क्विंट है. ये 6 महीने के अंदर ये स्क्विंट नहीं होना चाहिए. 4-5 महीने में थोड़ा सा स्क्विंट है, आप इंतजार कर सकते हो. 6 महीने में अगर स्क्विंट परसिस्टेंट है, हर वक्त है, इमीडिएटली किसी को जाके दिखा दीजिए. ये अभी हमें ट्रीटमेंट करनी चाहिए इसके लिए. और तीसरा जो है, अच्छा दूसरी पॉइंट ये भी बताना चाह रहा था कि अगर कोई बच्चा मतलब 1 महीने के अंदर उसकी 90 डिग्री या 60 डिग्री की स्क्विंट है, एक आंख उधर देख रही है, एक आंख इधर देख रही है, वो सही नहीं होने वाली. वो इमीडिएटली जाके दिखाइए. मैं क्या बोल रहा था कि ये 4 महीने के अंदर जो ये फिक्सेशन डेवलप होता है, वो 10-15 डिग्री का जो स्क्विंट होता है वो सही हो जाएगा 6 महीने के अंदर. अगर नहीं होता है जाके रेफर कर दीजिए. और आखिरी चीज जो है वो लेजी आई की हम बात कर रहे थे, जो एम्ब्लियोपिया हम बोलते हैं, ये 2.5 years के पहले हमें फाइनलाइज करनी चाहिए. क्योंकि इसमें क्या होता है कि एक आंख की नजर ज्यादा अच्छी रहती है, दूसरी की कम रहती है, और ब्रेन इसी पे 2 साल 2.5 साल के अंदर डेवलप हो जाता है. और उसके बाद में इसका इंप्रूवमेंट करना और कठिन हो जाता है. हमने 17 साल 20 साल के बच्चों में भी हमने इंप्रूवमेंट की हुई है, मगर जितना जल्दी बच्चा आए उतना अच्छा हमारे लिए. तो इसको हम एम्ब्लियोपिया बोलते हैं. नेक्स्ट स्लाइड प्लीज. I think that's तो यही मेन चीजें थी. I think we can go back 2 slides for the different types of conditions that are there. One above this, I think. Yeah, thanks. तो ये जो मैंने अभी तक सब जो बातें की हैं, this is only for the basic thing. मेरे ख्याल से अगर आप लोगों को कुछ भी डाउट है, आप मुझे डायरेक्टली बात कर दीजिए. प्लीज स्पीक टू मी डायरेक्टली इफ देयर इज एन इशू. दीज आर वेरी फंडामेंटल इश्यूज. I can go into depth with it, but I think it'll get lost out. I'd rather have an interactive session where you people ask me questions and I'm able to answer it.
Absolutely, absolutely, Rekhi sir. Thank you so much for the simple
Can I stop
explanation of.
sharing, sir?
No, Brinda, leave it on. In
Yeah.
case somebody identifies something, they want to expand on it, they might forget the terms. Just let it be there. Yeah.
So parents, we are open for question and answer round. You have anything related to vision of your child, you can ask, and sir is here with us. And he has taken out time from his busy schedule. He's a very, very busy person in his OPDs. So we request anybody has any question, otherwise, ma, on behalf of it. Yes.
Good evening, sir.
Yes,
Good
yes,
evening.
Vandana.
Yeah, ma'am. Sir, my son is 10 years old now, but
Okay.
his squint has not gone.
Yeah.
हाँ, आपने उसे जयपुर में देखा था शायद, तो
हाँ जी,
squint
I'm not able to.
Vandana,
Vanda,
आपका
you'll be
video,
able to switch on your video.
yeah, can you put your
okay,
video?
okay.
हाँ.
Yeah, okay.
हाँ वंदना जी नमस्ते, कैसे?
नमस्ते सर. सर, एक्चुअली बेटा मेरा 10 इयर्स का हो गया है,
हाँ
लेकिन उसका स्क्विंट जो है अभी तक है.
हाँ.
स्क्विंट
See,
अभी
इसमें
गया
क्या,
नहीं है.
हाँ तो इसमें क्या होता है, जैसे मैं आपको बता रहा था, डेवलपमेंट कैसे होती है, पहले हम एक आंख से देखते हैं, फिर दूसरी आंख से देखते हैं,
हाँ जी, हाँ
और
जी,
फिर 6 महीने के अंदर हमारी दोनों आंखें साथ में काम करने लग जाती है.
हाँ जी सर.
तो ये, हाँ तो ये जो फंक्शन होता है, एक आंख का जो विजन है, दूसरे आंख का विजन है, इसको जोड़ के जो हमें नजर आती है, उसको हम
हाँ
3 डायमेंशनल विजन बोलते हैं.
हाँ जी सर.
मतलब
ठीक
जैसे
है.
एक आंख से अगर आप कुछ चीज को देखो, आप वो
हाँ जी,
फ्लैट नजर आती है, 3D के साथ हमें डेप्थ नजर आता है.
हाँ जी,
ये फंक्शन 6 महीने के पहले डेवलप होना चाहिए.
हाँ जी,
अगर बच्चे ने कभी भी दोनों आंखों के साथ नहीं देखा है,
हाँ जी.
उसके
मतलब
बाद में स्क्विंट नहीं सॉर्ट आउट होगा. मतलब जो,
अब नहीं हो सकता.
हाँ जो स्क्विंट रहता है, मानो अभी आप मेरे को 20 साल का बच्चा भी दो, उसका स्क्विंट रहेगा, उसको मैं सीधा कर सकता हूँ सर्जरी के साथ,
अच्छा,
मगर
ओके,
दोनों आंखें साथ में नहीं काम करेंगी.
अच्छा,
वो जो
ओके.
साथ में काम करने का जो मिलन होता है, दैट
हाँ
हैज
जी.
टू डेवलप बिटवीन 2 months ऑफ एज एंड 6 months ऑफ एज.
या
अगर वो
यू
बच्चे ने,
हाँ.
अगर मानो उसने 1 घंटा दिन दोनों आंखों के साथ काम किया है,
हाँ
40
जी, हाँ
साल की
जी,
उम्र में भी मैं दोनों आंखों को साथ में काम करा सकता हूं.
हाँ जी, हाँ जी,
तो कभी
हाँ
कभी
जी.
जब हमारे पास बच्चे आते हैं जिनका परमानेंट स्क्विंट होता है 5 साल की उम्र
हम्म,
में, 6 साल की उम्र में, इसको
हाँ जी,
अगर, अब क्या होता है, अब अस्पताल में जाओगे, डॉक्टर बोलेंगे सर्जरी कर दो, स्क्विंट्स को ठीक कर देंगे. इसमें क्या
ठीक
होता
है
है,
सर.
कॉस्मेटिकली करेक्ट हो जाएगा, आप जो देखोगे वो सही रहेगा, मगर
अच्छा,
बच्चे को दोनों आंखों के साथ काम नहीं कर पाएगा, फिर से एक आंख बाहर घूमने लग जाएगी. और
अच्छा,
रिमेम्बर, कोई भी जो सर्जरी होती है, एक तो जनरल
हाँ,
एनेस्थीसिया में होना है,
हाँ
दूसरा
जी,
है ऑपरेशन के बाद आंखों को टच नहीं कर सकते हैं. जनरल एनेस्थीसिया में हमारे बच्चों को बहुत ज्यादा रिस्क है कंपेयर टू रेगुलर पॉपुलेशन. तो
अच्छा,
हमारे बच्चों में हार्ट का प्रॉब्लम ज्यादा रहता है.
हाँ जी सर.
So general anesthesia is a big risk. How are you going
हाँ,
to prevent the child from touching the eyes? ये सब बहुत
या
कॉम्प्लिकेशन हो जाती है.
हाँ
डॉक्टर
जी
को
सर.
बोलना आसान है, वो तो ऑपरेशन कर लेगा, उसके बाद बोलेगा अच्छा आपको ये आंख में इन्फेक्शन नहीं होनी चाहिए, बच्चों को आंख मत टच करने दो. आप कैसे करोगे?
हाँ जी,
सो अ
हाँ
लॉट
सर.
ऑफ द चिल्ड्रन, इफ द स्क्विंट इज देयर, वो नहीं जाने वाला है, उसको छोड़ दो. उसको बाद में अगर आप चाहो आप कॉस्मेटिकली करेक्ट कर सकते हैं, वो 18 साल के हो जाएगा, उस टाइम आप देख लेंगे, पूरा चेहरा तो बनने दो, तब सारे एंगल ठीक हो जाते हैं. मुझे
ठीक है.
इंपॉर्टेंस है फंक्शनल इंप्रूवमेंट का, कि अगर मैंने रिस्क लिया है ऑपरेशन करने के लिए,
हाँ जी,
तो रिस्क में जो बेनिफिट होना चाहिए कि बच्चे को दोनों आंखों के साथ देखेगा, तो हमें बहुत इंप्रूवमेंट होती है, एक थर्ड डायमेंशन हो जाती है. तो
ठीक
थर्ड
है सर.
डायमेंशन का मैं आपको बताता हूं. मानो अगर आप सीढ़ी चढ़ रहे हो,
हाँ जी, हाँ जी,
तो एक, मतलब सीढ़ी का हाइट क्या है आपको एक नजर आता है, एक लाइन नजर आती है.
हाँ जी, हाँ जी,
जब आप सीढ़ी के नीचे जा रहे हो,
हाँ जी,
अगला जो स्टेप है वो 1 इंच का है या 1 फुट का है, आपको महसूस नहीं होगा अगर आपके पास एक आंख काम कर रही है.
अच्छा,
इसलिए ये जो बच्चे होते हैं जिनकी एक आंख काम कर रही होती है, हम लोग सोचते हैं कि 2 आंख काम कर रही है,
हाँ
बट
जी, हाँ
अगर
जी,
एक बच्चा है जिसकी सिर्फ एक आंख काम कर रही है, बच्चे बचपन से, वो ऊपर नीचे भागेगा,
हाँ
सीढ़ी के
जी,
ऊपर भागेगा, नीचे
हाँ
जाने के
जी, हाँ
समय
जी,
में वो बैनिस्टर को पकड़ के जाएगा, क्योंकि बचपन
यस
से वो
सर.
गिरा है, उसको मालूम है जो स्टेप्स है, उसको गिरने टाइम, नीचे जाने के टाइम में गिरने का मतलब रिस्क ज्यादा है। घर में
हाँ,
जो सीढ़ी है वो ऊपर नीचे चलेगा, बाहर कहीं नहीं जाएगा, वो गिरेगा।
अच्छा,
तो एक हैबिट हो जाता है उनका ये। जैसे आप देखो कि कोई मानो मुझे एक बोतल से पानी में के ग्लास में पानी डालना है,
हाँ जी,
आप
हाँ
कैसे
जी,
करोगे? बोतल को हाथ में पकड़ के आप पोर करोगे।
यस सर,
जिसकी एक आंख है वो ग्लास एक हाथ में पकड़ेगा, बोतल एक हाथ में पकड़ेगा, बोतल का माउथ ग्लास के ऊपर रख के फिर पोर करेगा। क्योंकि वो
ठीक है,
मतलब ये मतलब अगर ग्लास इधर
यस,
है, वो
हाँ हाँ,
ग्लास के इस साइड या इस साइड में नहीं पोर करेगा, या तो सेंटर में होगा या उसके आगे होगा या उसके पीछे होगा।
हाँ
इसलिए
जी,
वो हाथ में पकड़ के उसको मालूम पड़ जाता है कि मेरे एक हाथ आगे या पीछे है। तो ये जो थर्ड डायमेंशन होता है जिससे हम ये डेप्थ नजर आता है, वो सिर्फ दोनों
हाँ
आंखों
जी,
से नजर आता है।
ठीक है। एंड सर वन मोर थिंग, ये स्कूल में जैसे जाता है लाइक फॉर 6 आवर्स, तो वहां पे तो पहन के रखना है, अपना स्पेक्स पहन के रखता है, लेकिन घर पे अगर पहनाए तो उतार के फेंक देगा, तो
उसका
मे बी
मतलब वो
बिकॉज
पहन
ऑफ
रहा है वो टीचर को
प्रेशर,
खुश करने के लिए।
या ये
That is the
मुझे
whole
लगता
issue.
है।
That is what my point was. That
हाँ
allow
हाँ,
the child to take off his glasses if he is happier. We want the child
या
comfortable and happy. If
हाँ
he is
हाँ,
happy, he will learn. If he is not happy, he's not going to learn.
हाँ हाँ,
अगर आप अपने आप देखो ना, घर में उसको आप कुछ काम करने के लिए बोलो, कुछ कलरिंग
हाँ
है
जी,
या कुछ भी एक्टिविटी है,
हाँ हाँ,
चश्मे के
यस
साथ
सर,
अगर वो 2 मिनट के लिए कर रहा है और चश्मे के बिना 5 मिनट के लिए कर रहा है, कौन सा अच्छा है?
यस सर, हाँ हाँ, ये ऐसे ही करते हैं बिल्कुल, विदाउट
Then take
स्पेक्स
off the
बहुत अच्छा
glasses. I
रहता
don't
है।
want the glasses on. He's more comfortable without the glass.
Relax,
सर
Vandana. I think.
कैन यू सी हिम जस्ट वन, एक बार ये देख लीजिए,
जरूर जरूर
देखिए
दिखाइए।
ये
So
देखिए
by the time
Ma'am, I'll
your eyes
stop sharing,
grasp
otherwise
that
they can't
visual,
see fully.
yeah, yeah.
Yeah. No, I think I'll need a closer examination. Perhaps the next time that we are here, we can have a look at him.
Yeah.
हाँ,
He's got a little bit of a squint, nothing to worry. What we will do
ओके
is
सर,
we'll have a look at him next time we probably meet.
यस सर,
He will do quite well. इसको
या
छोड़ दो।
थैंक यू सर, थैंक यू सर, थैंक
इसको
यू,
छोड़
Thank
दो।
you, Vandana. I
थैंक यू
think
सो
we'll move
मच,
on to the next question because questions have
थैंक यू,
started pouring. So this is our dear Hema ma'am only. She's asking, the child tilts the head and doesn't focus with both eyes on the presented material. Can this be because of a lazy eye? The
Sir, I would like to elaborate. Can I
Hema
elaborate,
ma'am,
please?
please. Yes,
No,
please,
Hema,
Hema
tell me.
ma'am. Please.
Yeah, the child is 8 years old, and when we are trying to teach something to the child, he is tilting his head away from the material, and probably is looking through one corner of the eye. I'm not very sure, but he is able to recognize the material later when I ask him. That means he's seeing it from some corner.
So here there are two issues. Firstly, if it is a power related issue,
Yeah.
sometimes if you squeeze your eyes and make it very tiny, vision improves. Okay. But what
Mm.
you're telling me is he's moving his head to one corner.
Exactly.
So when he moves his head to one corner, where are the eyes going? To the opposite corner.
Yes.
So when you have a child who has got something known as a nystagmus
Uh-huh.
or certain types of abnormal movements in the eye. So
Mhm.
when I look at you, I want you to see my face. I'll
Yeah.
see if I can sort of zoom in a little bit. So I can look at you straight, correct?
Yeah. Yeah.
Now, when I do this, I'm still looking at you straight, but I'm
Yeah.
seeing you from right gaze. My eyes
Exactly.
are on the right.
Yeah.
This is left gaze.
Yes.
So like this, we have 9 positions. I have straight gaze, up gaze, down gaze, left,
Okay.
right, up and
Yeah.
left, down and left, up and right, down and right. So there are 3 points here, 3 points in the center.
Okay.
Now, sometimes our eyes work as a team
Mhm.
better in some position.
Okay.
So if, for example, let's say I've got nystagmus.
Uh-huh.
If my nystagmus is 10 degrees, my vision is 5%.
Okay.
Now, in left gaze, for example, my
Mhm.
nystagmus may become almost zero. So my vision from 10% will become 60%.
Okay.
So if you ask me to speak to you, I will talk to you. When you ask me, say, look at something, I will do this and see. This is my
Huh.
left gaze right now.
Okay.
So instead of, now, unfortunately, what happens is when we are teaching a child like this, we say
Mhm.
that look straight.
Mhm.
So eventually, what does the child do? The child looks straight to please you. But if you leave the child alone, he'll immediately do this. So
Yes.
what we have to do in this situation is change the environment, present everything on the side that the child is comfortable to stabilize the neck.
Okay.
So for example, if I have to see like this to see you comfortably, what if I move my camera here? Now my camera is on my left. Now my neck is straight and my eyes are to the left. My vision is good. I am comfortable.
Okay.
So a very common thing happens with children. I'll say this in Hindi also. बहुत common होता है ये जो movement जो होता है जहां हमारी नजर अच्छी हो जाती है मानो अगर ऊपर में अच्छी हो जाए तो जब ये बच्चा खाना खाता है बचपन से ये ऐसे करके प्लेट को देखेगा अब प्लेट को नहीं देख सकता है तो वो क्या करता है प्लेट को थोड़ा सा दूर पुश कर देता है और फिर वो खाना खाता है और जब वो डिस्टेंस प्लेट का और उसके हाथ के और जहां उसका चेहरा है वो डिस्टेंस बढ़ जाता है खाना गिर जाता है टेबल के ऊपर जब खाना गिर जाता है माँ क्या करती है प्लेट को आगे पुश कर देती है ये फिर से बाहर पुश करता है फिर वो माँ पुश कर देती है फिर ये खाना नहीं खाता है फिर सब बोलते हैं बेचारे को भूख नहीं लगती है वेरी पुअर ईटर गर्म हो जाता है खाने को फेंक देता है असल में बात ये है जो वो आपको कम्युनिकेट करना चाह रहा है कि मेरी नजर यहां पर नहीं अच्छी है मुझे ज्यादा अच्छा नजर आता है जब वो दूर होता है मैं ऐसे करके मैं देख पा रहा हूं और अब लोग बोलते हैं सीधा देखो वो क्या खा रहा बेचारे को नजर नहीं आ रहा है सो दीज आर what I'm trying to say is whenever a child has a particular head tilt or a head turn or a face turn note it. Take pictures, send it to me. My job is to try and explain in most cases where I'm able to help you. I may not have the answers for everything, but I may have an answer to at least 10-20% of these children, which will be able to answer and help them function better.
Oh, sure. Thank you.
I
I'll
hope that
take pictures and
answers.
send it to you. Thank you so much.
Yeah. My pleasure.
I have to interrupt here. A lot of people, when we are having children like this, who are tilting their heads and keeping it in that position, they are actually sending them to the neurologist. Am I right, Hema?
Yeah, sometimes.
Have gone to the neurologist saying that the head tilting is to do with the entire neck and the nerves and am I right? So there's
sometimes. Yes,
Yeah.
it's also happening, and there's something called as vision therapy also,
Yeah.
wherein they say that they're trying to fix the eye movements and all that. But I'm not very sure. So I've actually suggested
No.
one of our students.
Vision therapy works, Hema. Vision therapy works if it's done properly.
Okay. Right, sir. Thank you so much.
Okay.
सर अनदर क्वेश्चन इन द चैट बॉक्स इज कि मेरी बेटी 10 साल की है वो नजर मिला के बात नहीं करती उसका जो पावर है -6 है ग्लासेस का और वो फिर से बोल रहे कि कोई नंबर रिड्यूस करने का कोई तरीका है या कुछ आप इसको सलाह दे सकते हैं पेरेंट को
बहुत सिंपल चीज जो है कि एक मुझे नंबर अगर 6 है या 10 है या 20 है मुझसे उसे कोई एतराज नहीं है मेरा यही है कि एक बार ही चश्मा देख ले पहन ले नजर कितनी है तो आपकी मानो अगर आप हमारे पास बहुत पेशेंट है जिनका पावर 0 है और उनकी नजर नहीं है क्योंकि आंख का पर्दा सही नहीं है या डेवलपमेंट सही नहीं हुई है या नर्व ठीक नहीं है और हमारे पास बहुत पेशेंट है जिनकी पावर -18 है उनकी नजर एकदम नॉर्मल है मगर चश्मा पहन के उनको नजर आता है तो एक तो जो है नजर पावर को कम करने के लिए एक ही उपाय है वो है जो आपकी हाइट है अगर आप उसको कम कर सकते हो तो पावर थोड़ा सा कम हो जाएगा क्योंकि हमारे जैसे हाइट बढ़ती है हमारी आंख का साइज बढ़ता है जैसे साइज बढ़ता है पावर बढ़ता है नॉर्मल क्या है जो एवरेज जो होता है बच्चा रफली 1.5 या +2 का पावर से पैदाइशी से होता है ये +2 +1 हो जाएगा फिर 0 हो जाएगा जब तक कि बच्चा 14-15 साल का हो जाता है अगर आपका पावर 0 है तो -20 तक पहुंच जाएगा बचपन में अगर 0 है तो फिर -20 तक पहुंच जाएगा अगर आपका पावर +0.5 हो बचपन में तो -3 -4 -5 तक आता है बट ये सब चिंता की बात नहीं एक बार ही चश्मा दे दिया चश्मे का मतलब ये है कि वो फोकस सही पर्दे के ऊपर जा रहा है कैमरे का फोकस सही है उसके बाद में पर्दा कैसा उसको सिग्नल कन्वर्ट करता है हमारे ब्रेन को नजर कैसी ब्रेन से ही नजर आती है सिंपल एग्जांपल मैं आपको देखता हूं हम जो भी यहां पर आज देख रहे हैं अगर मानो आपका कोई फेमिलियर पर्सन हो उनका आप फोटो देखो जो आउट ऑफ फोकस फोटो है ब्लड है मगर आप बोल सकते हो ये तो मेरी माँ है या मेरा बाप है या मेरे बेटी है या मेरा बेटा है अगर मैंने आपको एक फोटो दिखाई किसी और अन्य आदमी की, which is sharp photo, you have never met the person in your life, you cannot tell me who that person is. You can describe it, but you cannot tell me. तो विजन जो होता है, it's a brain function. तो अगर बच्चा चश्मा लगा के आपका चेहरा नहीं देख पा रहा है या आपके चेहरे को डायरेक्टली नहीं देख रहा है, उसका मतलब वो स्टेप 1 जो हम बोल रहे थे फिक्सेशन, वो नहीं डेवलप हुआ है. और देयर इज a different type of fixation known as eccentric fixation has developed. This has to be determined. अगर एक्सेंट्रिक फिक्सेशन डेवलप्ड हुआ है, उसका मतलब जैसे आप बोलो मुझे देखो, और बच्चा कभी भी आपको 5 डिग्री दूर देके आपको देखेगा, कभी ऊपर नहीं, कभी नीचे नहीं, कभी लेफ्ट नहीं, एक ही एंगल में आपको देखेगा. कि मानो जो मैं बोलूंगा मुझे देखो, उसकी आंख इधर देखेगी, मैं बोलूंगा मेरी उंगली को देखो, वो इधर देखेगा, मतलब वो 5 डिग्री का डिफरेंस कभी भी रहेगा. वैसे बच्चे में दैट इज गॉट गुड विजन, but the vision will never be 100% normal. It will be 20, 30, 40% less than normal. That has to be developed. और इस किस्म के बच्चे का कभी स्क्विंट मत सॉर्ट आउट करो, बहुत कॉम्प्लिकेशन हो जाता है, बच्चे को दो नजर आने लग जाता है. I don't know if this answers your question, but I need to be able to examine this and then figure out whether it's a problem or no. अगर कईयों को भी यहाँ पर कुछ complication है, please send the details to us online. We'll be able to answer.
जी. So sir, you mentioned about -6 power glasses, that if you can reduce the height, the vision can better. Same goes for the +3 size also, because the parent whose
If you
child
can
has
increase height,
+3 number.
power will come down.
Okay, so I think you parents have got the
No, but
answer.
to
Then
add to this, there is some technology that has come in the last 7 years where
जी.
typically when you are, suppose we have a child who's 5 or 6 years of age and the power is -3, और हम जानते हैं इस बच्चे का पावर अभी -10 या -11 तक जाएगा. इसके लिए अभी एक ड्रॉप्स निकला है जिसके साथ there are some chances of the vision or the power not going to full level but will be reduced by 50-60%. There are spectacles available for it. There are specialized contact lenses available for it. But the biggest therapy for it is play in the sun. 1.5 hours of exposure to sunlight per day will start reducing the increase in power. It will not reduce the power, but जो -3 से -6 को जो जाने वाला था, it will maybe go to -4.5. The spectacles work very well. We've been using them now for about 4 years. I'm quite surprised how well they are working in some children. Even yesterday, we've had a child, 2 years, the power has not changed. And the child has gone from, she's in a growth phase now. Nothing has happened. We've got many children where nothing has changed. Some children where power has changed, but at least it's something we are able to do. The drops which are available are basically atropine drops in a very diluted form. There is some controversy whether they work or they don't work, because more than 3 years I don't want it used, and that is in any case contraindicated for our children. Atropine जो drops है, कोई भी बच्चा जो अस्पताल में जाता है, atropine drops are not to be used. I cannot emphasize this enough. Do not use atropine, because atropine causes problems with the heart rate. And most of our children have some heart issue or the other. So in the case that we don't have an issue, not a problem. But by and large, as a rule, there are other drops which help in dilation during an examination. They can be used. Atropine, home atropine, anything where the word atropine is there is not to be used. There is a drop called
Yes.
cyclopentolate, which can be safely used on our children for dilation purposes.
So it's a
How
point to
long
note.
have you been this experiment, this thing you're saying that these drops or these glasses, how many years has that been that experiment?
They have been in existence for the last 7 years to
Okay.
8 years. They were launched in India just before the pandemic. I was one of the first people in the country who has a private clinic to get it,
Okay.
and it was extremely expensive in those days. We have used it post the pandemic. I am actually quite impressed with the way it's working, and the prices have significantly come down. They were, I think, 45,000 rupees for a pair of glasses. Now it's about 15,000 rupees.
So
But
you
they
recommend
really
it for
are
our
good.
children?
In the case where we are able to get a child who is young enough with a power which is around -1, -2 in that range, and the vision is reasonably good, yes, I will say definitely do it, because I am not concerned about the power going up.
Mm.
Our concern is that when the power goes up, the eyeball becomes bigger,
Mhm.
and the inner lining, that is the retina, does not grow after birth. So you are born, let's say 2 kilos, 2.5 kilos of birth weight. Your adult size is 60 kilos. So you've grown 20 times. The eye is actually 70% developed at birth. The reason is the retina is fully grown. So as the eyeball becomes bigger, the retina is only stretching. So that is why if you look at a population of 100 people, 15% of the population, the retina is smaller than the eye. In other words, it is stretched. And that is why these are the people who are more prone to retinal detachments, glaucoma, more problems with macular degeneration. These are all issues that occur later on. So if you can slow down the growth of myopia, you are potentially saving a lot of complications for the future. That's the basic advantage of these glasses. I don't care. I have got patients who've got minus 14 power, but the eye is small. I have got people who've got zero power where the eye is big. So, but generally, as a thumb rule, all your film actresses, big, beautiful eyes, all have got minus 3 to minus 14. I think I've seen 2 actresses in my life of power of minus 1. All the others have got. So the moment the eye is too big, the retina is generally speaking. So I told you, out of 100 people, 15 will have weak spots in the retina. Out of the 15, 12 will have a power minus more than minus 3.
Okay. So that was a quite an interesting thing to know. So, sir, we'll take more questions. It says,
Sure.
Johnsy asking that my daughter is 8 years old. She has small bulge under both eyes
Okay.
and watching TV and mobile too closer. Is it due to the habit or some vision issues?
So if she is watching the mobile close to her face, firstly, I'm very happy because that tells me she's using her eyes and she's able to see. Now, the fact is, why is she bringing it close to her face? So, 2 reasons are normally there. Either she might have a minus 4 or a minus 5, which means things far away are not clear. When you bring it closer, it becomes clearer. This is one possibility. Second, and most likely, the reason is her vision may be less than yours. So, let's take an example. My vision is 50% of yours. What you can see at 1 foot comfortably, I will see it half a foot comfortably. What you will see at 10 feet comfortably, I will have to go 5 feet for me to see it comfortably. It is simple mathematics. So if the child is bringing things closer, I have no objection to it. I have a problem that if today the child is bringing the phone, let us say 10 inches away to do a particular task, and 6 months later to do the same task, the child is bringing it 4 inches away. So either the power is increasing or the vision is coming down, both of which cause concern to me. But the fact that the child is bringing it closer, I am very happy. उसका मतलब बच्चा टीवी को देख रहा है या is able to use the eyes.
Johnsy, I think you have understood what sir is saying. You want to add or ask anything else? You are there, that's why I'm asking.
Hello, good evening, sir.
Good evening.
I'm Johnsy here. Just clarifying my doubts regarding the vision, doctor. Just want to know, he has small bulges under eyes. That is since birth he has that. But is it because of the eye issues or is it anything else, doctor?
The bulges
I
under
don't know.
the
What you can do is just send me the picture of it. Let me have a look at it. But see, anything that is a swelling is always an indication of some sort of an accumulation of fluid, or sometimes it's just a natural appearance of the eyes. So what to me, observe and see whether it's getting better or is it getting worse. If it is remained the same, do not touch it at all.
Okay, doctor.
Can I have a look at her straight away? Just let me have a
the
quick look.
light. Yeah, the light is behind Johnsy, so it is. Sir, can you see? Okay.
Okay.
I'll need to see a bigger picture, I think. I'm not able. Can you put her as the main?
We have to
Okay, so
pin
I'm
her.
not able to see it. It's too small. It may be easier for you to just take a photo and send it to me. My mobile
Sure,
number, I
doctor.
think, is there. Just let me have a look at it.
Sure, doctor. Thank you.
Sir, the another question says मेरी बेटी 9 साल की है, उसकी दोनों आइस की जो पुतली है वो हिलती है, आईसाइट वीक है, बाय बर्थ चश्मे के पर बनानी है, बट लगाने में कंफर्टेबल कभी नहीं है, बिना चश्मे के शी इज वेरी कंफर्टेबल, ब्लैक बोर्ड से कॉपी करने में दिक्कत है, चश्मा लगाने पे हमेशा कहती है धुंधला दिखता है, आइस पूरी खुलती है, टीवी देखते समय पूरा हेड उठा के देखती है.
Correct. So this is a classic case of nystagmus. कि आंख लेफ्ट टू राइट हिल रही है। तो डिस्टैग्मस में एक चीज होती है, या तो बचपन से होती है या बचपन के बाद में आती है। अगर बचपन के बाद में आती है, इट इज, आई वुड कंसिडर इट एन इमरजेंसी एंड सेंड इट टू अ न्यूरोलॉजिस्ट इमीडिएटली। बट अगर बचपन से है, तो जैसे अगर आप ये कुछ भी चीज को आप ट्राई कीजिए, आप सीधा देखिए, जो भी आइटम आप देखना चाहते हैं आप उसको देखिए, वो आपको आराम से नजर आएगा। अगर आप 5 डिग्री मानो, जो मेरा फोन है मैं अभी देख रहा हूं, अगर मैं इधर देखूंगा मुझे फोन नजर आएगा, बट आई कैन नॉट सी एनीबॉडीज फेस, बिकॉज हमारा जो सेंटर में जो विजन होता है वो 100% रहता है। उससे आप 1 डिग्री आउट, 5 डिग्री आउट जाओ, 1 मिलीमीटर साइड में जाओ, आंख के अंदर नजर 10% रहती है। तो जिस बच्चे में डिस्टैग्मस बहुत ज्यादा होता है उसकी नजर कम रहेगी। तो दो चीजें होती है जो बचपन से डिस्टैग्मस होता है, एक तो जैसे उम्र बढ़ेगी ये जो मूवमेंट होती है वो कम होते जाएगी, उसका मतलब नजर विल इंप्रूव। सेकेंड थिंग इज, हर डिस्टैग्मस में जो बचपन से होता है उसका एक आइटम होता है जो उसको हम नल पॉइंट बोलते हैं, जो है कि एक ना एक जगह में वो जीरो हो जाएगा। तो जैसे हम पहले बता रहे थे, जो बच्चा जिसका नल पॉइंट ऊपर में है वो ऐसे करके देखेगा, नहीं तो ऐसे करके देखेगा, दैट इज वेयर हिज विजन बिकम्स बेटर। सो इफ यू गिव हिम अ पेयर ऑफ ग्लासेस जिसका पावर सब सही सेंटर में ही होता है, ऐसे करके देखो तो फ्रेम आ जाती है बीच में, वो कहां से नजर आएगा? तो वो चश्मे को निकाल के देखेगा। ये नहीं कि पावर नहीं है, जो डॉक्टर ने पावर दी है वो भी सही है, मगर जो प्रैक्टिकल एप्लीकेशन होती है बच्चा ऐसे करके देखता है। Rekha ji has seen me with this for years. The first thing I do in any camp that I go, सबसे पहले मैं चश्मा निकाल देता हूँ। तो पहले चश्मा निकालो ना, चश्मे के बिना कितना नजर आ रहा है वो पहले देखो। चश्मे के साथ थोड़ी सी मदद होनी चाहिए, इट शुड नॉट बिकम अ हिंड्रेंस। So if the child is seeing from the side, please encourage it, do not discourage it. Now, like I said, if the child, I still remember this. One of the first cases I did of this was not with the Rekha Ji school. It was with the Vidya Spastic Society of India in 1991. We had a beautiful child, a girl called Archana. I have taken her permission to give her name. She used to have a type of nystagmus कि एक आंख ऊपर जाती थी, एक आंख नीचे जाती थी. Very smart girl. Her, unfortunately, her null point was up and left. आप जरा ट्राई करो, अपनी जो फोन को देखना है, आप अपनी गर्दन को नीचे करके इस एंगल में करके जरा देखो कितनी देर आप देख सकते हो। ये बच्चा इतना स्मार्ट था, बच्चे द टीचर्स यूज्ड टू कॉन्स्टेंटली से सीधा देखो, जैसे वो टीचर चली जाए वो ऐसे करके किताब को पढ़ती थी। तो हमने क्या किया, उसी स्कूल में एक पेंटिंग क्लास था, तो पेंटर्स ईजल में लेकर आया और डेस्क के सामने रख दिया, और मैंने उसको यहाँ पर साइड में रख दिया। अब किताब उधर रख ली, अब देखो बच्चा सीधा, नेक सीधा था, आइटम जो पढ़ना चाह रही थी यहां पर आ गया। Now in 1 month she did more than what she had done in 3 years. That is the kind of improvement you can get if you stabilize the neck. This is not rocket science, this is simple common sense. The child is telling you, I see better like this. आपका जो बच्चा है कहां से देखता है, राइट साइड से देखता है, लेफ्ट साइड से देखता है?
ज्योति आप अनम्यूट करोगे, बिकॉज आपके ने बताया 9 साल की बेटी है और वो सर पूछना चाह रहे हैं कि वो बचपन से या अभी स्टार्ट हुआ है उसको पुतली हिलना
यस
आंखों की?
मैम।
हाँ
हेलो। यस मैम।
हाँ
दिस इज ज्योति। मेरी बेटी की जो आईज हैं वो बाई बर्थ ही हिलती हैं, पुतलियां।
हाँ, और किस साइड से देखती है, लेफ्ट
और
साइड से
वो
देखती है, राइट साइड से
जैसे
देखती है?
सर लेफ्ट साइड, और मतलब कि वो तो सही है, लेफ्ट और राइट ऐसा नहीं कर रही है, पर मैंने ये ध्यान दिया कि जैसे वो टीवी देखती है तो टीवी देखते समय अपना पूरा हेड ऐसे उठा के देखती है।
उठा के मतलब चेहरा ऐसे उठा हुआ है जैसे मैंने किया हुआ है?
बिल्कुल।
हाँ, तो उसका
जी हाँ
मतलब
जी।
उसका नल पॉइंट नीचे में है, विच इज अ वेरी गुड थिंग, बिकॉज हमारा 90% एक्टिविटी नीचे में होती है। तो जैसे अगर ये जो है टीवी देखेगी, ये शी विल लाइक टू लाई डाउन एंड वॉच टीवी, क्योंकि टीवी देखने के लिए कितनी देर में ऐसे देखूंगा, अगर मैं लेट के देखूंगा तो मुझे ज्यादा आराम से नजर आता है, मेरी आंखें नीचे में ऑटोमेटिकली होती है। और हम लोग बोलते हैं लेट के मत देखो।
वो बैठ के देखती थी, बट ऐसे करके फिर वो कहती थी मतलब हेड के पीछे जो है दर्द हो रहा है, तो फिर वो
हाँ,
मतलब काफी लॉन्ग टाइम अगर कार्टून देख रही है तो फिर दर्द होने लगता है। मैं मना करती थी लेकिन
क्या
वो
है?
उसी तरीके से अभी भी
हाँ, तो अगर उसको आप चांस दोगे कि वो लेट के देखेगी या रिक्लाइन करके देखेगी ताकि उसके आंखें ऑटोमेटिकली नीचे में है, वो ज्यादा देर टीवी देख पाएगी। जैसे अगर फोन है, आप अगर उसके पास फोन, अगर आप देखो वीडियो की, वो अपने चेस्ट के ऊपर रख के देखेगी, लेट के चेस्ट के ऊपर रख के देखेगी ताकि उसकी आंखें नीचे ऑटोमेटिकली पहुंच जाती है।
और सर मैंने ये भी ध्यान दिया जब ये बाय बर्थ ही मतलब बिल्कुल छोटी सी थी बर्थ के टाइम, तो अपनी जो विजन जो भी चीजें जैसे छत देखते हैं बच्चे या फैन देखते हैं, तो वो सर अपना ऐसे नॉडिंग में
I'm not able to hear.
Yeah, Jyoti, your voice is distorting. I think there's a connectivity issue. So we are not able to clearly hear आप बोल क्या रहे हैं. आप टाइप करके दो. आप टाइप कर दो chat box पे. We'll ask. Sir, we need to know that how regularly we have to take our kids for eye checkup, and how early do we refer an infant with Down syndrome to you?
So I want to see babies. I think we've always said this. I want to see from birth. But typically, like I told you, if you go back to that initial slides that I talked about, 3 milestones. The first milestone is fixation by 4th month. Second is no squint by 6th month. So ideally, if I can get a child by the 6th month, I'm happy. That's my first test. My next test, mandatory, is before 2.5. So ideally, what I like is 6 months, 1.5 years, 2.5 years, and every year after that. Or in certain cases, more frequently or less frequently. But 6 months and 2.5 years is mandatory. Those are very important milestones.
Yeah, so I think that everybody has noted and you have reiterated, so we'll remember. So Jyoti wanted to say that वो अपना head mostly ऐसे हिलाती थी in no, like नहीं बोलते हुए हिलाते ना, right to left. वो शायद वो बोलना चाह रही थी बचपन से.
No, so it's not the eyes that are moving, it's the head that is moving.
head.
ये head movement is a very different thing altogether. Head nodding is more will fit into neurological areas. It was not be an eye related issue 99% of the time. That will, I thought you were talking कि आंखें हिल रही.
वो भी लिखा सर. तो ज्योति आप ये कहना चाह रहे हैं कि आपने एंटिसिपेट किया वो आंखें भी हिलती है तो वो सर इसलिए हिलाते कि उसको बैलेंस करने के लिए.
समीक्षा, मुझे लगता है डायरेक्ट डॉक्टर रेखी से बात करें.
ज्योति आपका वॉइस बिल्कुल क्लियर नहीं है. नहीं
ज्योति, आप डॉक्टर रेखी
अपना केस
बात करिएगा. वृंदा जी आपको कनेक्ट कर देंगे. मुझे लगता है आपकी आवाज क्योंकि नहीं आ रही है और हम आपको नहीं सुन पा रहे हैं यहाँ पर. आगे बढ़ते हैं समीक्षा.
Yes, I think from chat we have taken most of the questions. Rekha ma, would you want to ask something on behalf of the rest of the Humsafar family?
You got all the answers for all the questions?
Yes, ma.
I think he was absolutely clear. Only thing is, I think Hema, is there anybody in our center who we have seen with issues? Because like he said, yes, they do head tilting, the usual, and taking off glasses, not wanting to wear the glasses, what we are watching from birth. And I think the most important thing is to identify issues as early as possible. This eye capping helps, Rekhi? Capping the eyes to develop the power?
Yeah, so that is a therapy for amblyopia. So basically, suppose, to go back to the example I used earlier, one eye is 0 powered, one eye is +3. So the right eye, which has got +3, has got very poor vision because it has not been, the brain has never seen sharp.
Okay.
So in this situation, what we do is we cover the good eye, give the spectacles so that the retina has a proper focus and force the brain to use a bad eye. It's like saying if you're right-handed and I want to develop function in my left hand, I should tie my right hand completely and only use my left hand. Initially, it is horrible, but gradually the brain will learn how to use it. So this is a very old system of treating amblyopia. It is called patching.
Patching, right.
Patching works. It has advantages. It has some disadvantages. But that is the traditional method. 99% of the people will use patching for working. My objection to patching is that suppose my right eye vision is 50% or 30% of what the left has got. With patching, I will bring it up to, let's say, 80%. But then when I open both eyes, this will drop down again because my brain has never used two eyes together. So today, the more modern methods and the technologies that we use or the systems that we use is that, yes, we will develop the vision in this eye, but we also give techniques of telling how the brain can use both eyes together. And then you will retain the vision in this and sometimes even improve beyond 80%. But it is all to do with taping, covering, exercises. And actually, this is a lot. Somebody mentioned vision therapy. This is a part of vision therapy. Vision therapy is nothing but how do you get the brain to use the eyes more effectively.
Right.
If it's done well, it is fantastic. We've actually even found children with autistic abilities. And again, I don't know how many of our population actually have spectrum disorders. I'm sure there will be a group.
Yeah.
And a lot of them have very low attention span. So there are techniques by using visual therapy that you can actually increase their attention span and also increase their ability to look at your face directly. So there is work being done on it. But
Yes,
like anything that is new and unregulated, there are lots of people around who say vision therapy and they don't know what they are doing, but they charge a huge amount for it.
That's also
That
dangerous.
is the problem we are reaching now. Huh?
Yeah. So another thing I wanted to ask you, most children in school, the might not be able to see the board or whatever it is, and then we are not getting admissions based on these things, saying that the child cannot see, the child is not concentrating, the child has vision a major role in all of this?
Yes, it does. So attention is one role, and the amount of vision is also a huge role. So a lot of our kids, their vision is not the same as what others see. It may be 20% to 30% lower. It is there. So these are children who do need to go closer to the board. And in the formative years, there is no blackboard work. It's all predominantly play and looking at things around and interaction, which is what we want. We want the children to integrate and have inclusive education. So that initial phase is very easy. Post that is if you have a child who has to copy from a board to the book, there are other strategies that the schools are able to do. Some schools are doing it. Is you copy from a neighbor's book or you copy from something that is close by. That can be done. But if they start using that as an excuse to not give our children this thing, I think that is incorrect.
But most often what I get complaint is, मेरा बच्चा लिखता नहीं है. He's not able to see the spaces in the rule books, so they are, constantly being punished. So they or being told that your child, because see, this promotion thing is a big thing with our parents. And now we don't want them to be repeating the same class again and again. So in school is where we are seeing the biggest issues with our children, where we don't know how often we can come back and get the right doctor to check the vision and tell us, okay, your child can see, can do. We need the reassurances all the time.
Yeah, so I think we probably will have to take up maybe 2-3 specific cases, work on it and see how we can work on these 3-4 cases and then maybe expand it to other schools and find out some strategies, expand the pool that we are working with and do it. As of now, I think maybe I've had 1 or 2 kids who've come into me in the office from you who have actually spoken about this matter, but nobody else has spoken about it to me. So I have not had this as a...
The reason they don't bring it to you is because they think, oh, we have to go only for the vision. They're not getting it connected with the sequence of events that happen with that. So yeah. I say that thyroid, vision, hearing are all 3 major issues that we need to check before sending them to schools. But I think that a lot of people who get to me now the schools have opened. So there will be issues coming up.
So let's work on this on a specific thing. So the next time some reference is coming, tell me this is the problem in the school. Then at least we can assess them for it and maybe speak directly to the teachers and work on it. See, what I really like to do is get the parents to get the teachers to speak to me. And I tell them if the teacher doesn't want to call me, I'll call her. I have no issues with it. But I need to know what problem she is facing and can we help it or tell her that this is how the child is seeing it. You have to learn to live with it.
Okay.
See, in many situations, the teachers don't know what the child is seeing. And if they know what the child is seeing, they are actually quite willing to teach.
So I think what we should do now is to have a session for school teachers and try to encourage them to understand what it is we are facing with our children. So that, it becomes easier if everybody is also empowered to understand the subject.
Correct. As a matter of fact, why say that it is our children? Say that on our panel, we have people who will explain to you about vision in children.
Okay, done.
So it is pertinent to anybody, no?
Absolutely.
And
So
Dr.
more
Rekhi,
They
so,
might be more interested that way. That's what
Yeah,
I'm
they
talking.
might.
Absolutely, absolutely. When it is for the larger population, all the
I agree.
education department, yeah.
Okay.
Yeah.
सीमा का एक सवाल है डॉक्टर
हाँ, माँ सीमा का वही सवाल है डॉक्टर रेखी कि वो 20 साल की उसकी बेटी है, वो चेकअप नहीं कराती है, वो शी कांट फोकस ऑन इन दैट आई चेकअप मशीन। सीमा, तो वो उसका चेकअप ही नहीं हो पा रहा है।
हेलो,
No, बोलो।
हाँ।
Hi, सीमा।
नमस्कार सर। हाँ जी, हेलो
Namaste.
एवरीवन। सर उसका 2017 में उसका चेकअप करवाया था, चेन्नई से ही आकर करवाया था। तो उसके बाद से जो है वो स्टार्टिंग में अपना चश्मा डालती थी, उसके बाद उसने हटाना शुरू कर दिया, यहाँ पे हेड के ऊपर रखना शुरू कर दिया। और अभी भी मैं उसको डालती हूँ तो वो डालती नहीं है। बट अगर विजन से रिलेटेड चीजें देखो तो वैसे वो नॉर्मल है पूरा। बट मैंने नोटिस किया जैसे खाने की प्लेट सामने रखती हूँ तो उसको थोड़ा सा स्लाइटली वो राइट साइड जो है वो अब कर देती है, और खाना पहले के कंपैरेटिवली अब थोड़ा सा खिंडाती है। हाथों में फिंगर्स में थोड़ा शिवरिंग आ गई है उसके, और जिसकी वजह से उसकी वजह से भी जैसे लिक्विड कोई भी सूप या दाल वाल खाती है तो हल्का सा वो भी शिवरिंग की वजह से थोड़ा गिरता है। वो पता नहीं उसका रीजन क्या हो सकता है। बट हाँ, उसको आई टेस्ट के लिए उसके बाद मैंने बहुत 3 से 4 बार जो है वो लेकर गई, बट कोई भी उसका आईसाइट नहीं कर पाया, क्योंकि वो 10 to 15 सेकेंड्स के लिए भी वो क्या है कि वो उसमें देखती नहीं है, वो जो उनका चेक करने वाला रहता है। तो
Is
उसमें
she
मेरे
taking any medication right now for anything?
ओनली थायराइड।
Check her thyroid levels. Why would this shivering come otherwise? So either it is a neurological issue, or it could be related to
Or
thyroid,
it
that
is
this
thyroid. Her
shivering will
thyroid
come.
levels. सीमा, talk
If-
about the thyroid levels पहले। बोलो यार।
थायराइड मैम, माँ जो सा अभी उसका करवाया था मैंने अगस्त में, तो अगस्त में जो सा है वो 14 समथिंग आया था। बट 14 से ऊपर कभी नहीं गया, कभी एक बार बॉर्डर पर भी पूरा आ गया उसका, ऐसा बात नहीं है। अभी 88 mg ले रही है वो थायराइड का। तो अभी मैंने फिर करवाना है, दिल्ली में अभी वो होगा तो मैंने कहा मेडिकल
Do
सेंटर
it
में
and
वहां।
then get back to us. But she definitely had a very abnormal thyroid levels.
हाँ, और अदरवाइज सर वैसे उसका आईसाइट अगर कभी देखो, क्योंकि उसको हीटिंग का बिहेवियर इशू है, तो अगर कई बार हम देखते हैं तो वो सामने देख रही होती है, बट उसका जो निशाना है वो बिल्कुल हीटिंग का
Side में
इतना
आएगा।
सटीक सटीक बजता है कि अगर उसने टांग भी मारनी है किसी को घुमाकर, बिल्कुल एकदम मारकर और वापिस आ जाएगी, जितनी देर में दूसरा सोचता है कि हाँ इसकी टांग आएगी अभी, तो उतनी देर
Correct.
में वो मारकर साइड हो जाती है। तो उससे ऐसे लगता है कि इसकी आंखें चारों तरफ है लगी हुई। तो कई बार बहुत सरप्राइजिंग भी वो रहता है कि हाँ ऐसे कैसे, और इसका मतलब दिख तो सही रहा है उसको।
करेक्ट। सो इसमें भी क्या होता है ना, जैसे ये जो टेस्टिंग का जो हमारा जो सिस्टम होता है, इट रिक्वायर्स अ सर्टेन अमाउंट ऑफ कंसंट्रेशन। So from what you're describing to me, this is a child who is aware, highly intelligent, because once she has seen something, she has already made a note of it कि वहां पर है। उसको फिर से दोबारा देखने की जरूरत नहीं है। She will not like repetitive tasks. If she does something, अगर आपने उसको बोला ये काम करो, फिर बोलो और उसने कर दिया, दूसरी बारी आप बोलोगे वो नहीं करेगी, क्योंकि वो she has shown it to you, she can do it. Why should she do it again? So this is where that some children do not like doing repetitive behavior. There's a very common thing. Actually, this could be a spectrum thing also. It's one of the features of the spectrum what we were talking about. So you cannot test eyes on these children the way we normally would test an eye. So here we are not looking for them to respond. We have to see roughly what the power is, just from a pure point of view of power. See, remember, power का मतलब ये नहीं कि नजर अच्छी है। चश्मा लगाओ उसका मतलब ये नहीं कि आपकी नजर अच्छी हो जाने वाली है। कभी कभी चश्मा लगाने से नजर खराब हो जाती है। सो डोंट लुक एट इट फ्रॉम दैट पर्सपेक्टिव। What you have to see is how much is she able to do. There is something known as, एक हम चार्ट में आपको बोल सकता हूँ, आपका आपने 4 लाइन पढ़ी है तो आपका नजर 6/18 है या 6/12 है. दूसरा होता है फंक्शनल विजन. What you are describing to me, she's got fantastic functional vision. Yes, she likes things to the right. अगर वो टीवी देखेगी, वो सेंटर में नहीं बैठेगी, सोफे के लेफ्ट में बैठेगी ताकि टीवी उसके राइट में हो. ये सब चीजें होती कि she likes things on the right hand side. That's all to do with the way the eyes work together. And the way the vision is. So I don't think you should worry too much about it, but try and get something of an approximate power for her. And if the power is close to -1, -2, छोड़ दो, she will not wear that chashma.
वो एक्चुअली सर प्रॉब्लम कहाँ आ जाती है, क्योंकि नॉन वर्बल है कि और उसका आईक्यू लेवल बहुत कम है, 24 है, तो उससे पता नहीं लग पाता कि उसको क्या चीज क्लियर है और क्या चीज नहीं क्लियर है.
Correct. That is what I said. We are not asking her to read. We have to see what the power is. पावर जब हम मेजर करते हैं उसमें हम, जैसे अगर आप मेरे पास आओ, मेरे को कैसे मालूम है आपका पावर -10 है या +10 है? आई डोंट गिव यू ऑल चॉइसेस. मेरे को हम एक टेस्ट करते हैं जो 2 मिनट लगता है या 30 सेकंड्स. अच्छे हम लोग तो 10 सेकंड 20 सेकंड में मुझे मालूम पड़ जाएगा कि आपका लगभग नंबर -1 है या -2 है या +3 है या +4 है. हमें मालूम पड़ जाता है. इसको ऑब्जेक्टिव टेस्ट बोलते हैं. आपको कुछ बोलने की जरूरत नहीं इसमें. इसी के लिए हम वो कभी कभी वो ड्रॉप्स डाल के हम टेस्ट करते हैं. तो अगर वो बच्चा कोऑपरेट 30 सेकंड्स के लिए भी कोऑपरेट करेगा, मुझे ये मालूम पड़ जाएगा. उसके ऊपर में हमें देखना है कि पर्दा सही है या नहीं है. उससे हमें मालूम पड़ जाता है कि अगर हमने चश्मा दिया कितनी नजर आ सकती, हाउ मच पॉसिबिलिटी क्या है. उसमें भी गारंटी नहीं है, मगर पॉसिबिलिटी है. हाँ, अगर पर्दा सेंटर में ठीक है, उसका मतलब है ठीक है, आप 90% विजन आ जानी चाहिए. सो बेस्ड ऑन दैट यू टेक अ डिसीजन.
Yeah, okay.
Thank you, sir.
Yeah,
Welcome,
Sami,
welcome.
Parul, you're winding down.
Yes, ma'am. Thank you so much, Rekhi sir. As usual, आपका the way you answer the question is always interesting, and it directly hits the right point in the parents' brain. They understand, okay, ठीक है, यहाँ concern है, यहाँ हमें guidance लेनी है, और यहाँ हमें बस अपने आप को मना के रखना है कि नहीं, बच्चा comfortable है तो हम भी comfortable हैं. पारुल, आप क्या बोलोगे?
जी, मेरे कार्यक्रम का समय समाप्त होने को आ रहा है, तो मैं चाहूंगी कि हम अंत की तरफ बढ़े. अब ये बहुत ही अच्छा सेशन रहा है, हमेशा की तरह डॉक्टर रेखी के साथ पे, और जिस शांत स्वभाव के साथ वो जवाब देते हैं और जितना क्लियर करके वो जवाब देते हैं, जितना डिटेल में वो जवाब देते हैं, मुझे लगता है इससे बहुत आसानी रहती है हमें उन चीज़ों को हमारी भाषा में समझने में. तो हम बहुत शुक्रिया अदा करना चाहते हैं डॉक्टर रेखी का कि उन्होंने अपने कीमती समय में से ये समय निकाला हमारे लिए, और यहाँ आके हमारे पेरेंट्स के इतने बिल्कुल बारिशों की तरह सवालों के जवाब दिए हैं. इसके लिए हम धन्यवाद देते हैं. और वृंदा जी, आज के सेशन के अंत की तरफ हम बढ़ रहे हैं.
Thank you so much for your time.
Rekha ma.
Thank you.
Yes.
No, my pleasure. One point I'd
Thank
just
you,
like to
sir.
add. There was
Yeah,
somebody who wanted us to speak in Tamil.
Yeah.
If she's in Chennai,
sir.
she's most welcome to come and meet me directly. We can talk
Yeah.
to her, or she can call me. We can do it.
Okay.
Absolutely. I
She is from
think Brinda
Chennai, sir.
conveyed
I'll
that.
ask her to. Yes, I already
Yes.
told her. I will ask her to connect with you, sir.
Thank you.
Thank you, sir. Thank you so much,
Thank you
sir.
so much,
Thank you,
Thank you so
everyone.
much.
I'm ending the session now. See you all next week.